Staying on health, the Upper West Regional Director of Health, Dr. Damien Punguiri, says the refusal by nurses and other critical staff to accept postings to rural areas has affected the fair distribution of health workers in that region. He notes that despite the service rolling out incentives to attract them to those areas, the majority refuse these postings, negatively impacting health delivery in that region. There is more in the story.
The three-day 2022 Annual Health Sector Performance Review meeting of the Upper West region affords stakeholders the opportunity to take stock of what transpired during the year under review, exchange ideas, document lessons learned, and chart the way forward in the realization of improved health outcomes in the region. Upper West Regional Director of Health Services, Dr. Damien Punguiri, laid bare plethora of programs embarked on during the year under review.
With support from partners, we conducted 15 rounds of COVID-19 vaccination in all districts in a drive to achieve optimum population immunity. The region successfully responded to 2 new public health emergencies, that is yellow fever outbreak in Wa East and Sisala West districts, and monkeypox virus outbreak in the Wa municipality. As a region known for seasonal meningitis outbreak, we continued with capacity building of staff on meningitis surveillance and also strengthened supportive supervision at all levels.
Dr. Damien Punguiri noted that fair distribution of nurses and other critical health staff continues to be a challenge as they refuse postings to rural areas despite the service putting incentive systems to motivate staff working in deprived areas.
In the year under review, a total of 508 staff of various categories working in deprived areas were promoted to their next grade ahead of their counterparts in non-deprived areas. And a total of 334 staff serving in deprived areas have been given provisional study leave to pursue further training in the next academic year. I encourage all staff to accept posting to all parts of the region where their services are needed.
There is, however, good news for the region as the number of doctors increased from 58 to 93, thereby drastically reducing the doctor-patient ratio.
All districts in the region now have at least 1 doctor, and 9 out of the 11 districts have at least 2 doctors, meaning that when one is not available, the other can cover for the person. The doctor-to-population ratio has thus reduced from 1 to 12,000 persons in 2021 to 1 to 9,897 in 2022. I would like to use this opportunity to commend the Director General of Ghana Health Service for allowing the region to use its quota to acquire clearance for doctors willing to work in the region, but who were not without clearance. So during the year, some doctors were posted to us after giving clearance, but they decided to not show up. So we contacted the Director General, and he allowed us to use the quota to engage those who were their juniors. They have completed and were sitting at home waiting to be employed. So we advertised, and they came in, and this brought in a good number of doctors to the region. If this policy is allowed to continue, Mr. Chairman, the region could achieve its requirement for medical doctors in the next few years.